Yes, hello and welcome to today's webinar on Help or Hindrance, Intergovernmental Organization in Times of a Global Pandemic. I'm Dr. Kristin Brandl. I'm Assistant Professor of International Business at the Gustavson School of Business, the University of Victoria. So let me just start this. Yes, so the agenda for today, we start with an introduction in what intergovernmental organizations are, and then continue with a little bit of a brief background and history of how the intergovernmental organizations came to existence, and then we go straight into discussing the implications of IGOs on the global COVID-19 pandemic, or the other way around as well, how the global COVID-19 pandemic is impacting intergovernmental organizations. And then I will give a little bit of a kind of summary or scenario of what I think what the implications are for the post-pandemic period, and then conclude the webinar, and we go straight over into some questions and answers, where you can also then ask me some questions related to my webinar. So let's start with the introduction. So before we get going and talking about intergovernmental organization, I think it's really important to start defining what intergovernmental organizations are in the first place. And so let's do that. Intergovernmental organizations are organizations which are created by a treaty, which was signed by at least 2 or more nation states. So it's really important to consider that these are governments who come together to actually create an organization. So these are nation states, governments coming together, and they come together in order to solve an international problem. So there are a variety of different of these international governmental organizations, and they're not to be mistaken with non-governmental organizations such as Greenpeace, which are really not, they might be connected to the government, but they're not governmental. Government signing basically a treaty and coming together and working collaboratively. So the characteristics of intergovernmental organization is the collaboration of these governments coming together. They try to kind of provide equality to all member states, and trying to basically come together to then collaboratively solve this problem. And they're often also connected to some sort of development process of more unequal countries as well. And inequality, I mean in terms of also poverty as well. So they're often in terms of development level and stage in equal countries in these organizations. And so there are quite a vast variety of different intergovernmental organizations who have a different focus and try to solve different international problems. Some are worldwide, and they're also called often multilateral organizations. Some are more regional. Some are based on economic or financial indicators or objectives, and problems that are more humanitarian. Then we have environmental, we have cultural, ethical, and religious related intergovernmental organizations, and then related to a vast variety of different industries as well. So the beauty of these intergovernmental organizations really that there is a vast variety, which of course makes it also very challenging to study these intergovernmental organizations and come up with like an overall generalizable conclusion. Here is just a small kind of sample of what intergovernmental organizations are, or kind of examples of intergovernmental organizations. And I picked particularly the ones who often quite well connected to the economy or the business environment, because of course this is Gustavson School of Business. So I wanted to draw basically to connection to really business related intergovernmental organizations. And what you can see here are, for example, the International Monetary Fund and the World Bank, who are 2 basically sub categories of the United Nations. It's also the United Nations Council of Trade and Development. So these are more the economic related one. And the United Nations, of course, is one of an organization which has a couple of like subcategories as well of and smaller treaties as well, such as the United Nations Council trade and development. And one intergovernmental organization I want to focus on a little bit more, despite the fact that it's not solely, or it's not the primary focus is on the economy or business and commerce related aspects, and that is the World Health Organization. And I think it's important to outline the World Health Organization specifically because I assume that you have heard of the WHO quite intensely over the last couple of months as a response to the global COVID-19 pandemic. And so I will talk a little bit more in detail about the World Health Organization, but I will really try to make this connection to also the business environment and make this very connected, not just to the health crisis we're in right now, but also how does it impact generally the business environment in different countries. And so what I would like to emphasize quickly is that each member state or member country who's part of these intergovernmental organizations can freely decide if they want to basically participate and sign the treaty and ratify basically to these to the treaty and the organizational setups and systems and regulations. And that is what is interesting, but also challenging, because consider that for the World Health Organization, 194 countries are participants and are basically influencing decision-making and influencing the system as well, and have to come to a consensus and conclusion makes it really difficult. And that's what I will explain in a little bit more detail as well when I talk about the history of these IGOs. But not all of these 194 countries who are part of the World Trade Organization, the World Health Organization, are also part of the World Trade Organization or part of the Organization for Economic Cooperation and Development, which is the OECD. The OECD has only, in comparison, 35 member countries. And so there is really a lot of member countries are part of different organizations and they have different focus. And so that is really interesting that these member countries are coming together and trying to solve a universal problem. But let's go back to the World Health Organization. As I promised, I would like to emphasize a little bit more the World Health Organization, just because of the importance in the global stage where what the WHO has implied or is implying right now. And so as you can see on the slide, it dates back to the 1948, sits now in Geneva, is a specialized agency of the United Nations, and it has the objective at heart that all people all over the world have the possibility, the highest possible level of health. And that is quite a broad objective, but it kind of is really interesting as well that it is so broad, because how can you define the highest possible level of health in such a vast variety of different countries who are part of the World Health Organization? And so that is really the challenge of a lot of intergovernmental organizations, and also a challenge of the World Health Organization, that you have basically a focus, and in this case it's health and healthcare, and allowing and providing the possibility for the population of a country really the highest level of health. But if you consider healthcare systems all over the world, I mean, you don't need to go far. You consider Canada and the United States, you can see significant difference of how countries' healthcare systems are set up, how they're basically implemented by the government, and how much focus the government has on certain aspects of a healthcare system. So sometimes healthcare systems are universal. We have that a lot in European countries as well, where they're not really privatized, but they're really governmental and centralized as well. And so these healthcare systems are, of course, very different to the healthcare systems we have, for example, in the United States, where there's a lot of privatized activity behind the system as well. And so it's really difficult for these member countries to come together in these IGOs and come up with a unified approach to certain problems and challenges. And that is even more enhanced if you consider the different development levels of countries. Like if you consider that a lot of these participatory countries are still developing, they still have the challenges in implementing certain systems, certain policies. And so the problem is really that the variety of different development levels of these countries is impacting, of course, also how these intergovernmental organizations decide upon healthcare related issues here with regards to the World Health Organization. And then not to forget that even in organizations like the World Health Organization, there's also a commercial aspect, the business related aspect. There's an industry behind these activities as well. It's in this case the pharmaceutical industry, the insurance industry, medical services often has private hospitals, for example, are also often an industry related aspect. So they also then impact the activities on the local scale as well, on the domestic scale of the member states. And so that is really what is a challenge of the intergovernmental organizations. And let's go back to the history and how these intergovernmental organizations actually came into existence, and the collaboration of different countries in order to make the world basically a better place harks back to the late 19th, early 20th century, when we had the first governments coming together and trying to really solve a certain problem collectively. By 2019, the Union of International Associations counted 7,745 intergovernmental organizations. So there is really a vast variety of different of these organizations. They also, of course, include all these specialized assemblies or specialized subcategories of the United Nations. And so there's really a vast variety of these different organizations with different functions and different membership criteria. So each of these IGOs have a specific system in place, a focus and a membership criteria. And so some of them are related to financial support to the organization. Others are required that you have a certain policy in place or a policy system in place. And so if a member wants to become part of these organizations, or if the organizations, the treaty is founded, is basically there are these regulations which need to be complied with. And that always means also that some countries will lose their sovereignty. And that is a big problem of a lot of intergovernmental organizations. And if you go from an economic perspective, I know the Washington Consensus has been criticized quite heavily, but it really nicely explains how the intergovernmental organization, or the problems in intergovernmental organizations, has been from the foundation of the organizations. Because consider that you have regulations in place, and specifically the World Bank and International Monetary Fund are founded on these arguments that every country, every member country has to have a certain fiscal and monetary system in place. They have to have state influence or less state influence and deregulation. There should be certain trade and investment liberalization. And so there is basically one country, Washington, the United States, or the developed world in general, came up with these 10 regulations which needs to be complied with if you are a part, or if you want to become part of these IGOs. And that is just very difficult for some countries to execute and to do, because we have a lot of state influence, we have a monetary system and fiscal system based on religious beliefs. So there's just it's just impossible to combine all of these different countries. I mean, the World Bank, 164 countries are part of the World Bank, so it's really difficult to really combine all of these different perspectives, systems, and so forth, and make sure that they're all treated equally. And so the outcome of these were then pictures like this, which reflected quite well how initially in the first, let's say, mid-20th century, early 21st century, these IGOs were run. You have in the front the really wealthy European countries, the United States, the countries who decided that we needed to have these assemblies, these intergovernmental organizations to help the poor, but really we don't really consider too much the different levels of development. We really just go ahead and do our thing and decide these are the regulations, this is how a country should be run, this is really how the IGOs should be run, and how the regulations should be implemented, and how countries should look like. And so of course the poor and developing countries struggled with this, because they did not have the same level of development, have the same financial support as well to implement all of these regulations and comply with all of these new regulations, as the picture kind of really nicely depicts. And only in the last couple of years, I would say maybe towards the end of or the beginning of the mid-21st century, we're having a little bit of a change of the objective of IGOs, and also a change of the voice which was given to a lot of developing countries. So they kind of started to understand we need to raise our voice, we need to come up and say, no, we are unique, we have unique requirements, and we need to be heard as well. We need to have reforms which are complicit with our systems as well, and not just with the systems of the very developed world, which is influenced by basically the wealthy West and developed countries. And so we started seeing a little bit of a change in IGOs, and that was great. There was reforms were made in the World Bank and the IMF as well, and the World Trade Organization, the World Health Organization. You could see a lot of support going towards the developing countries, and their perspective was taken into account, so that all of the systems which were implemented really also supported and not just helped or followed kind of the idea of the developed world, but also took the developing countries into account. But then, this is a great picture. I really like this because it kind of exemplifies a little bit what happened specifically in the last couple of years, because we could see that the initial idea of IGOs, of countries coming together, governments coming together and collaboratively working together, has been basically taken away, and there's turned their backs towards this globalization idea, and it became much and more a deglobalization discussion. So more nationalism, more being focused on the national and the country development, rather than really collaborating across the world with other countries. And so this is where we were prior to the COVID-19 pandemic hitting, and now we are in the situation where we are facing a world health crisis, basically, which impacts every country around the world. And so the IGOs were starting to respond to this pandemic. And although some of them a little slowly, but most of the intergovernmental organizations really started to pledge their support for member states. They started to implement basically systems as well. The existing IGO systems have been tested if they are really in place properly, if they have been acknowledged by all member states as well. And so we can see that there has been elaborate responses, some more than others, to the COVID-19 pandemic. And if you go to really the big intergovernmental organizations, the World Trade Organization, the World Bank, the OECD, you can see that there have been really measures in place which try to overcome in this case, mostly economic challenges related to the pandemic or as a result of the pandemic. And so what is important is as well is that we could see that in the World Bank, for example, we have still the pledge that every country who's part of the World Bank receives the support for development as well. I mean, consider there are some countries who are struck much more and who are challenged by the COVID-19 pandemic much more. I mean, there are countries like Burma, Myanmar, the individuals in those countries don't get $2,000 like we have here in Canada because they cannot temporarily work. So their entire existence is at stake here. So we need these intergovernmental organizations right now to also financially support and help these countries because of the result of the COVID-19 pandemic. So not necessarily just the health related aspects, but also what is the outcome of not being able to work for the next couple of days. And previously, in these countries, we had a lot of community support, but we don't have that any longer if the entire community is out of work. So there is no falling back system, really. There's no social system in place in these countries who could support as well the individual farmers or the individual people in these countries. So the IGOs have taken on a really important role in trying to overcome some of the challenges and respond rather in their way quickly to basically the pandemic and the resulting challenges which are faced by the populations all over the world. And so if we go back to the World Health Organization, we can also see that the World Health Organization has rather quickly, I would say, responded to the global pandemic, and, you know, defined it as a pandemic in March, and then established additional assemblies and guidelines and webinars. You can basically go to the World Health Organization and participate in online webinars every other day. And there is written responses for governments, for firms. So there's quite a lot of output basically, and regular output and regular update about the COVID-19 pandemic and how to overcome the challenges with the pandemic on the World Health Organization. And what I find is really particularly interesting with the World Health Organization is that there has been such a coordinated response with regards to activities, not just of member states and members who are part of the World Health Organization, but also firms and other IGOs and organizations and foundations. So the World Health Organization hasn't just taken on the primary role of doing the work by themselves, but to collaborate and coordinate activities among a vast variety of different stakeholders. And that is really novel. This is really new. This is to this basically level hasn't been done before. And we could see that companies, firms, and I will only mention one, is Novo Nordisk from Denmark. They donated insulin. I mean, not every country in the world has access to insulin, so they donated $1.3 million worth of insulin to developing countries. And we have foundations who have pledged their support, financial support as well, to help specifically the developing world. So the combination of these stakeholders has been tremendous, and there have been solidarity trials from all member states, or from most member states around the world. Technology platforms to share research is going live in 2 days. So there has been quite an intense response in terms of collaboration from member states and other stakeholders. But of course, not everyone, all members were supportive of these activities, and there have been a lot of criticism and from a few member countries as well, related to political arguments as well, and related to the initiatives which were taken. And also there have been some criticism related to maybe missed learnings of previous crises. So there have been also some criticism related to the response to the COVID-19 pandemic of the World Health Organization. And so based on also the criticism and all of these previous to the pandemic negative developments related to the globalization, deglobalization discussion, I came up with basically two rather different scenarios of what I personally think how maybe the future of IGOs might look like after the pandemic. And so scenario A is a bit bleak, but it goes back to these arguments that countries have started to become more nationalistic. They start to basically be more sovereign and try to be really focused on the population rather than considering basically the world as a playground, so to say. So they start to withdraw basically from IGOs and started to focus more on the national level. And the United States, for example, has been quite vocal related to that. But I do think if that is a scenario where we're heading, then we can see a lot of IGOs falling. We can see that there will be, again, more of a survival of the fittest, or survival of the most developed countries, and absolute increasing inequality, because as we've seen over the last years, IGOs have really supported as well the development of some countries. There has been criticism related to that, but we could see that there is definitely some help as well in the development levels coming from these IGOs, and not just directly, but also based on maybe the economic progress which is made and so forth. So there's kind of direct and indirect implications. And so I think scenario B, I hope scenario B is more likely to happen, because what I can see right now and what I find really interesting is the really strong support by member countries, the most member countries, to collaborate. And not just by member countries, but also by firms and by other organizations, by foundations as well. So really coming together by academic institutions, by research institutions, really coming together and trying to collaborate in order to find a solution, in order to implement basically a vaccine or a treatment measure for the COVID-19 pandemic. And so if that collaboration could be maybe extended and the momentum can be used, I think we can see a more important role of IGOs in the futures, and we're going towards basically then a more collaborative environment, taking basically the momentum of the pandemic. And so I want to conclude with, I think IGOs more important than a lot of as often maybe recognized as well. They have taken maybe a back role sometimes, and they're not always in the news, but they have done tremendous work in the past. And they are essential for the potential recovery process, because only if we can basically globally find a treatment method which is implemented, I think then we can overcome the pandemic as well. And so I do think that IGOs, the role of IGOs will change in the future, but the question is, which way is it going? And I really do hope that my scenario B is the way forward and not the scenario A. So I'm open for questions and answers, and I do hope that we have some questions. So please write your questions in the Q&A sections. I don't see a question yet. Okay, here's the first question from Philip. Do you have any thoughts on the China involvement for donations to WHO and influence that they have? Yes, and this is, I've kind of indicated it a little bit in my talk, but I didn't really specifically outline the challenges we're facing right now in the WHO with the financing. So yes, China, oh, now I understand. Okay, right. So the first question was, do you have any thoughts on the China involvement for donations to WHO and the influence that they're having? And then what is the US saying on the main reasons why they are wanting to pull their funding? Okay, so these are quite connected. Okay, so the problem is, and I do understand that a little bit as well, that the WHO has tried to be quite conservative in the response to also the threats by the United States about the blaming of who's responsible for the COVID-19 pandemic. And I think the problem is, if you are a supranational or a intergovernmental organization, you have to be comparably careful as well to kind of have a political stance in the field as well. So blaming or kind of pointing the finger and saying that China is the reason for the pandemic is not the way the WHO is going, and is also kind of avoiding the arguments related to really trying to play the blaming game. So China has as much financial donations as well as a lot of other countries. And so there is no more basically or less financial donations of China as into the WHO as of other countries. And also considering that a lot of the financing is coming from quite a lot of other countries who have not started to play the blaming game. So I don't think that the donation in itself is influencing the way the WHO is behaving right now in not wanting to put blame on any country related to the pandemic. So I don't think that, and I think that is one of the arguments Donald Trump often brings forward, that the WHO is quite China-centric. But I also think that there are quite a lot of other countries included in the WHO, and they cannot just, because of one member country, basically take the blame. So there needs to be some sort of neutral environment as well. And so the reason why the US wants to pull basically the funding is that they find the argument not valid enough. So they find that there needs to be some responsible country basically responsible blaming for the pandemic in the first place. And so that is why they want to have basically a system in place which controls how the outbreak of the pandemic was dealt with and how basically the response to the pandemic was coming out of China. And China has said that they would be open to be for such a control system in place, a more neutral control system in place, but after basically the main pandemic has been dealt with. And so I personally think that the blaming game is not the way forward, and I do understand that there needs to be some neutral opinion about all member states, specifically in the times right now where everyone or every member state has to come together and pull together towards the same direction to try to find a way to overcome the pandemic. And that is basically what is done. And of course, that might look like it's more China focused and China centric, but that none of the responses basically in the current activities of the WHO is indicating that in any specific way. I do hope I actually answered the question, Philip. If I haven't, please ask again. Do we have any other question? Okay, Philip. I'm not sure it is a big myth, but what the US has been saying is that WHO did not move into China or didn't investigate the original issues related to how quickly they reacted to China and putting foods on the ground there in China. Could the WHO have delayed going in and searching and doing their own investigation, trusting China for having controlled their own outbreak? And the US is saying this is because China funds WHO to such a large degree. Do we know how much China may be funding WHO in a greater amount? Can we see how much other countries fund in relation? Yes, we actually can see that the WHO has made some of the data publicly available on the website. You can see that there is also the members basically contribute to some extent to the WHO. They have a requirement to financially support the WHO, and then there is voluntary support as well. That voluntary support by the WHO doesn't necessarily come from member states, though. They also come from external funding agencies as well, and firms as well fund the WHO. So there is quite a vast variety of different actors who fund and financially support the WHO. And I do understand that there has been criticism related to the WHO maybe not going onto site quick enough and considering basically being physically on site in China at the time. But I would also say that the response rate has been, the first really cases or the pandemic was classified as the outbreak was classified as a pandemic in March on the 11th, and then before that the first cases maybe around end of December, beginning of January. So they have been, I would say, also in comparison to maybe the last pandemics, in terms of timeline, quite a normal response for the WHO activities. The only difference, of course, is that there has been such a vocal opposition to that outbreak as well coming from the United States. So I do think if there wouldn't have been such a vocal blaming as well, that wouldn't have been such a tremendous outcry globally as well. So I do think that if you consider the activities which have happened in last pandemics as well, or in last health crisis as well, the response rate as itself has been quite consistent. And so, of course, you needed to have an observation for a certain period of time to see how this is developing before really there has to be, or there has been the claim of this is a global pandemic. And so I do think that a lot of the negative arguments has been because of the vocal outcry of some member countries rather than the more conservative opinion about some. And I do think that that is also politically influenced and not just based on the actual health related aspects. Do I have any other question? Okay, Shannon, what am I doing next?
That we can wrap it up, Kristin. That's great. Thank you. I'm just putting your email address into the chat. If anybody would like to ask further questions offline, that would be great.
Oh, I have a question from Adele.
There we go. We'll answer another one.
Okay, Adele, many are critical on the multinational organizations for the lack of leadership in coordinating the world response to the pandemic. A coordinated supply chain response would probably have resulted in a more efficient distribution of critical supplies where needed. Could the IGO do better? Yes, I do think the IGO could do better. I do think that the IGO has the possibility to maybe combine as well or control and coordinate a couple of these multinational enterprises and help maybe also to set up a globally sufficient supply chain as well in response to the COVID-19 pandemic. So I do think that if we allow the IGO as well to go beyond just the governmental national level, but also to coordinate a little bit more the firm level activities, such as the WHO has done in combining basically firms and coordinating and firms with foundations like the Bill and Melinda Gates Foundation, and then also related to the governmental arguments and governments who support, of course, the activities as well. I think there could be an overarching intergovernmental organization response as well. And so I do think that the IGOs have the possibility to do better because they have the possibility to control maybe and also have more of an umbrella activity rather than multinational enterprises, which are always have maybe different objectives as well sometimes. And the sub question was, what about the role of the World Trade Organization and the United Nations? Yeah, these are interesting points as well, because the World Trade Organization, I would say, has been, in comparison to a lot of the United Nations responses, not as active. I've seen that they have been active, but they haven't really come up with proper plans and systems in place, extensive systems in place, and how to impact or how to influence basically the response to the pandemic. What I've seen, which was really interesting with the trade-related intellectual property protection rights standards, so that's part of the World Trade Organization, that has been picked up by the World Health Organization related to finding a vaccine, so that there is no stealing of intellectual property in the sense which is recognized as part of the World Trade Organization's assemblies and agreements as well. And so they could maybe, I would say specifically the World Trade Organization could be more proactive in trying to overcome basically the pandemic and trying to work together to find a solution as well, specifically on the economic terms, and specifically also, as you mentioned, maybe on a global supply chain activity, because that is allowing the combination or control basically of the activities on a more umbrella term. And so the United Nations, I think, based on a different, I think the United Nations as itself is quite broad, and I don't think there can be a very centralized approach, but maybe on the specific special units basically of the United Nations, there could be a more coordinated approach related maybe to specific activities. There is agriculture related IGOs, and they could be maybe more proactive related to how can we make sure that the agriculture's value chain or supply chain basically is still functioning as a basically rollover to the response to the health pandemic. So yes, I do think that there is a possibility specifically from the World Trade Organization to respond to the pandemic as well. So Philip has another question.
And also, I believe our Dean, Dr. Saul Klein, has one.
Oh, great. I don't see Saul's though. But I do see Philip's. I was going to ask about the World Bank too. Are they able to help transfer payments and resources to the most of risk countries and populations, especially developed countries? Is WHO responsible for passing resources, money in order to buy and supply PPE and other medical equipment and supplies? Yes, the WHO is actually supplying PPE and medical equipment and supplies to specifically developing countries. So they specifically try to help the developing countries who are incapable of solving basically, or coping, not solving, coping basically the response to the pandemic. So there have been quite a lot of funding. There have been insulin and other medications which are difficult to get in these nations, donated basically by companies as well. And there has been financial support by the Melinda and Bill Gates Foundation has been quite financially supporting the activities as well. So the WHO has used resources and own money to support basically the very poor countries in the world in the last couple of months or weeks better. And then the World Bank, yes, the World Bank has started to transfer money to 100 identified developing countries, yeah. So they started as a response to the pandemic and to the activities of, or the resulting activities of the pandemic. They started to financially support the developing countries. It was actually in one of my slides, you can see these countries. If I go back to this slide here, you can see here, these are the countries basically which have received already financial support by the World Bank, and will continue also. So the World Bank has pledged to basically financially support more countries as a result basically of the response to the COVID-19 pandemic. Okay, Sal's question. We have been talking about global organizations struggling, but so too have regional ones. Yes, how effective do you think the EU has been? And that is a very good question. So I don't think the EU has been as effective as it possibly could have. And I think one of the problems with the EU has been also that prior to actually the pandemic, there has been quite a lot of challenges with the European Union based on a lot of nationalism, a lot of distrust going on in the European Union with the member countries. And so what I've been talking about as basically a pre-stage of the pandemic was this decline of the idea of coming together and having a global approach, or in this case a regional approach to a lot of international problems. And so we had in the European Union already quite a lot of challenges related to member countries disagreeing upon a lot of aspects pertaining to the European Union, and we could see that culminating in Brexit, basically the UK wanting to leave the European, or leaving the European Union. And so I think that the response of the European Union member countries has been quite slow, and I think could have been a little bit more proactive, and they had the chance to do that based on also the integration of the different countries through the European Union organization basically, and I was quite sad to see that there has been such an individualistic response to the COVID-19 pandemic, and I think there should have been a little bit more collaboration between the European Union member countries. But as I hope maybe it becomes clear that there is maybe a silver lining here, that if we can start based on the IGOs, or using the IGOs now to respond to the world, to the crisis basically, then we might be able to use that momentum in the future as well. And maybe there is the possibility to have stronger IGO connections as well, and stronger membership commitments as well in the future as a result of the response they have to provide now in order to find a global response for the pandemic. And so I do have the hope that maybe in the future that this is a result out of the response to the pandemic. Any other question? Adele, is the notion of a cross-national government a possibility? Ooh, Adele, that is a very tricky question. I don't know if we're there yet. I mean, that would be lovely to see, but I don't think that we're there yet. And I think that the major problem is really that we have so many different systems in place in different countries. And so it is really difficult to come to a consensus and come to a very, I mean, the regulations, if there is a cross-national government, the regulations would need to apply to so many different contexts that I'm not really sure I can see that in the near future. I hoped that would be a possibility, maybe in the far future, but I don't see that based on also where we were initially heading prior to the COVID pandemic. I don't think that if you would have asked me 5, 6, 7 months ago, I would have totally said, no, this is totally impossible. But I think the response to the COVID pandemic has shown that there is the possibility, and there is also the wish for some countries still to collaborate and come up and work together and really coordinate efforts as well to overcome such a global challenge. And so I do think now there might be more the likelihood that this is happening, but that is as a response of what we've seen lately, as a response to a lot of countries coming together and actually trying to find a solution to the pandemic. And maybe, again, the momentum going forward, but I find it really challenging to think that this might be a possibility, or that could have been a possibility specifically 7, 8 months ago. But it would be nice. I would definitely support that. Is there any other question? Adele, are we ready to trade offs between sovereign and safety and security as threats cross boundaries? Do you mean cross country boundaries? Yes. So sovereignty, safety, and security, these are quite strong words as well. So what I think is the problem with the loss of sovereignty is often, I think, maybe a little bit misguided, because technically each of the member countries of an IGO has a decision-making power in basically the organization itself. So there is seldom really a total loss of sovereignty. If you if you ask this question related to IGOs. So there is still the possibility for these member countries to participate in the decision making. I do acknowledge, though, that of course there are some member countries who are much stronger than other member countries. And that's what I said earlier as well, is that there is the problem related to how much weight, how much importance, and how much power basically each of these member countries has. And so I think that is related basically to the problem, to the loss of sovereignty. And then security and safety, I think that is what is at the heart of these arguments, that there is the loss of sovereignty in the first place, that there should be no basically there should be the possibility to prevent and protect basically their own population. But if there is really a functional intergovernmental organization which has a common goal of solving a certain problem, then there should be really an overarching security for all countries. It shouldn't be just for basically one country, so it should go across national boundaries. And so I do think that there is kind of this I think there's this misguided argument that you have to lose sovereignty and then you cannot protect yourself any longer. And I fully disagree, because if you're part of this IGO, you first have decision-making power, and then the objective is not to be at risk. The objective is really to find a way, which is very idealistic, I have to say though, to find a way to really protect the entire the entire member states. And so so that is basically the problem. Sorry, Adele, I just had to go to your addition. So the climate change, pandemic, economic recessions are example of cross-national boundary threats. Now it moved to open. Interesting. Okay, so so I totally lost my thought, but I think what you wanted to say is that the loss of sovereignty related to climate change, or related to the pandemic, or related to the economic recession, okay, are cross-national boundary threats. Okay, so now I understand. So the problem is that these IGOs, if they really, I mean, theoretically in the perfect world are functioning, then they have the way to overcome, and they possibly have some sort of possibility to overcome and to work against climate change and against the pandemic and against economic recession. And collaboratively, that would be working, but that would mean that really all member states have to equal decision-making power and have to equally contribute to how to solve the problem as well. So there cannot be individual member states who decide there needs to be a collaborative approach to this. And I know this is extremely challenging, because 160 countries coming together and deciding, having different development levels and different systems and different beliefs and different religions and different cultures and stuff like that, coming together and coming up with one approach is difficult. But I do think that there needs to be somewhat the possibility for these member countries to sit together and come up with a global way to control and to implement that. And we can see that now. We can see, as a response to the pandemic, that this is happening. We can see that developing countries, Costa Rica has suggested a technological platform which is going live in 2 days in the World Trade Organizations to combine all pandemic responses and all research done from all over the world. So we can see that also the developing countries who've, as I said, in the past been rather overlooked sometimes in some of these assemblies and not being taken in consideration, have started to step up and really participate in the IGOs and really try to participate in basically that coming up with a universal and cross-national boundary conclusion. And I do think that if if we take this approach and apply that to global the climate change, if we take that to maybe also to response to the economic recession, there might be the possibility to be more unified and respond to these threats in a more collaborative way, in a more also universal way, which is helping then also the world. I mean, the WHO always says, if we cannot globally contain the pandemic, we haven't succeeded in overcoming it, because if there is still one member country who has, or one country who has the pandemic, everyone is still affected by it. And so that, because it continues spreading and so forth, so there needs to be this global response. And I think if we can understand, if we use this response now, as we've seen, and then try to find a way maybe to also do that on other aspects such as climate change or economic recession, we might be stronger in the response. I know this is very positive, and I do believe in the good of the humankind. So I do hope that there is the possibility to do that, but we'll see. Thank you, Adele. Great questions. Shannon, I think we have no questions.
Excellent. Thank you. I just was waiting for your prompt. Thank you, everyone, for attending. That was Dr. Kristin Brandl for today's Uncharted Webinar Series.
Thank you so much.
Thanks, Kristin.